Here with me now is Ms. Monica Baigorri, Senior Environmental Health Specialist for the Monterey County Environmental Health Bureau. Welcome, Monica, and thank you for being here.
Good afternoon, Emily. Thank you for having me here.
Absolutely. So we talked all about lead, sources of lead, how to avoid it, what to do if there's been an exposure. And our last guest, Ann, mentioned that when they go into homes to do home visits, an environmental health specialist accompanies them. Now, what is the role of environmental health in these lead cases and home visits?
As environmental health specialists, we investigate the overall environment. We also look for sources, and we help in detecting source that could be the cause of the poisoning. We provide education on site. We work in the environment trying to prevent, reduce, or eliminate a lead hazard, and that is our goal.
Okay, so the goal is to figure out what the source is. So who does the home visits? I mean, we know you do, but what do you have to have in order to do these?
A certified lead inspector assessor is the one who conducts the risk assessment. This is an additional requirement that you need to be a lead inspector. To be a certified lead inspector, you had to pass an special exam from CDPH accredited lead training program provider. Once you pass it, you will be able to conduct lead risk assessment.
Okay, so this is a special certification on top of being the registered environmental health specialist. You now need a lead assessor certification.
Yeah.
And you said provided by a California Department of Public Health, that's CDPH, provided by a accredited trainer.
Yes, it's additional requirement. It's a very hard exam.
I bet it is. Environmental health specialists, let me just say, are the ones that get their hands dirty. You guys are in the soil, in the water, in the dust, in everything. And I just wanted to say that and give you all a bunch of credit for what you do. What do you do, or what does the lead assessor do during the home visit? What all do you do? You've got some things here I see. Take me through these things.
Well, I brought some of the things what we use in environmental investigations. And we investigate mainly three sources: paint, dust, and soil. To detect lead on site, we use this machine. This is an XRF machine, X-ray fluorescent. This machine will allow us to have a quantity level of lead if there is present. We go first with paint, and I cannot turn on the machine because it's radiation, but we go surface by surface in the paint, and we will be able to know on site if there is a lead-based paint, go over the standards that we accepted.
Okay, so you've got the XRF machine, and you point and shoot pretty much?
Exactly.
Okay.
Exactly. We had to ensure that nobody's around, and we moved the family to one place to another to try to keep everybody safe there. After we finish with paint on site, we take a dust sampling. And the idea is to go through different surface, floor, window sills, and what we do is take the sample, and again with the same machine we calibrate for dust, and we can detect if the dust in the house is lead contaminated. The third source is soil. What we do is we take a container, some samples, soils, and we go around the house, and certain distance we take soils, bare soil, And we put it here in the machine with soil mode, and we are able to detect if there is a presence of lead or not. Although we do this on site with the machine, we send all samples to a lab for confirmation. We always need a secondary confirmation for the result. We also take samples for water, tap water on site. Generally, we instruct the people to not to use the main faucet. Regularly is the kitchen, and in 6 hours. The idea is to, when we take the first draw, we will see if the faucet was leaching lead there. If in case of that it's not the faucet and it's the main source, then it's rarely you have lead in water now. But if this could occur, then we will be able to have difference between the first draw and the second draw of the tap water.
I see. And this machine, you can test the water with this machine as well, or no? This is for dust, paint, and soil.
It's for dust, paint, and soil. And also we can detect food, but not water. The water we send to the lab.
Okay, so this machine, the XRF, you have to I wasn't even able to hold it in here, to bring it in here. Only the registered lead assessor, only the certified lead assessor can even touch the machine, observing all safety precautions, can recalibrate the machine for various different sources right there on the spot in the home.
Yes.
Okay.
Even the food, as I said, sometimes the people want it, and you realize the parents are little desperate. When they have a child lead poisoned, they wanted to know and they wanted to help us.
I see. So you don't get into, there's not, you don't have a hard time with people in the home visits and trying to determine what all is in the home. You're opening cupboards, you're seeing things like this. No one's hiding anything from you.
Well, everybody wants to cooperate. Sometimes I think they don't understand very well why we had to open cabinet, why we had to open refrigerators, because it's part of the environmental investigation. Sometimes we find like ceramics like this, and then we ask the people there, the families, we say, do you use this one for it? Sometimes they say no, but I can realize that it's yes. Then that is issues, because normally the people who used to use this one, it's like they don't believe that this could leach lead in your food. Once the lead is in the food, you will ingest it and you will poison it. Not only you, your children, and that is the concern why we are there. What is the main things? Sometimes in the refrigerator with the visual inspections, we find food. Unfortunately, this is we call chapulines.
Chapulines.
The Mexican people eat this. I think they are grasshopper.
They look great.
I'm not sure, but the people have different culture and they eat chapulines. The chapulines are very high lead concentration. They are really poisoned food for children, even for adults. But that is part of the visual inspection. In the exterior of the house, we go around also, and we have to see the condition of the house. Deteriorate paint is a lead hazard, in special if the house was built before the 1978. When are chipping paint, the children like to eat it. The lead have a good taste for children. Unfortunately, they eat it. It's unbelievable. When I learned all this about the program, I realized that children can eat paint. This is why it's very important for us in the visual inspection go to frictions. A part could be doors, stopper windows. Also, chipping paint is health hazard because produce and create dust. and that will be in the house.
So I've heard the 1978 thing about 3 times now, and a paint prior to 1978 contained lead. Is that what this is about?
Before the 1978, yes.
Okay.
And after came different requirements for vendor.
Okay.
lead.
For
the
paint standards.
yes.
I just wanted to clarify that with our guests. So people are in general, people are okay with you coming over, opening cupboards, opening the fridge, because you're there doing an investigation and you're looking for the source of the lead that could potentially be, contaminating or exposed to their child. What is the conclusion of the home visit if you don't find anything? If this XRF machine doesn't register any lead?
If I don't find anything and we have everything negative and already we have obtained the result confirming that everything is negative, we can go to others place where the child stays. We could also go to grandmother's house, schools, daycares, something that could be time that where the child spends there.
Okay.
But one of the main thing is immediately we say you should feed your child with food high in calcium, high in iron, and that helps. Is something which helps to leach lead from body.
Okay,
from
so
the body.
if there's still high blood lead levels in children and you do not find anything in the home, you're going someplace else. And not only that, but you're going to recommend that the child begin to eat as soon as possible iron and calcium-rich foods. What happens when? What is the conclusion of the home visit if the lab confirms the positive test? Say the XRF machine, it's beeping everywhere, there's lead all over. I'm just kidding. But if the machine detects lead and it's confirmed by the lab, what happens then? What does that look like?
Well, our protocol indicate once we have positive reading, we have to write a letter to the property owner. In the letter, first, we explain the property owner why we went to the house. And second, we said you need a corrective action here because that is a hazard, health hazard. It's a risk that need to be eliminated. We gave and provide all the instructions how to do it, but right now had to be with a contractor lead certified also. They now educate the contractor in a way to do the work. But after the work is done, the environmental health specialist, I would say the lead inspector assessor, will go to conduct a clearance. A clearance is, I would say, a limited investigation. In that process, we need to ensure that the health hazard had been controlled or eliminated in appropriate manner. When we eliminate for more than 20 years, we said abated. That means it's already will not be there anymore. That's happened normally when you remove and replace something.
I see, instead of fixing it. Or
Exactly. Depend of the cost also. Sometimes a door is easy to remove and replace, and you eliminate completely the risk hazard there. But sometimes you won't believe, but people have been demolished a house.
Because repainting the inside and the outside of the home is...
The remediation will be very, very costly.
Right.
Then, yeah, and each case and each investigation is different.
I see.
Then it's important to know that we recommend them to look for help for professionals. This is what they have to do. This is for us very important that we make several recommendations. Already my 2 co-workers explained all what recommend to the public. But I will say if you have any question regarding with lead, just call to local health department We are there as a lead program to help and assist in whatever is necessary to do it. We work together to work in child protecting, in population protected, and promote a good health.
Wonderful. That's amazing what you guys do. There's, like I said, so much that goes into this. So, I think we may have time for one last question here. Do you have any final recommendations for parents when you do an environmental investigation? Excuse me.
The first things what I will say: do not disturb paint. Watch your child. If they are sometime playing with paint, you never know if they are eating. Then, if you are disturbing paint, it's worse if a house had been built before the 1978. And then the people doesn't know exactly. This is why we are constantly educating about that. Wash children's hands constantly, because the children, everything what they take, go to the mouth. And even 6, 7 years old, it's important to make the habit to wash hands before then eating, because if there is any lead contamination, will be ingested.
Well, thank you so much. I think that's just about all the time we're going to have today. If you have questions, as Monica said, regarding lead-based paint products or products at local businesses, please feel free to call Monterey County Health Department Environmental Health Consumer Health Protection Services at 831-755-4508. Again, the number for the Environmental Health Consumer Health Protection Services is 755-4508. Monica, thank you again for participating. You are such a wealth of knowledge and you have so much experience. Thank you for sharing it with us today. I'd also like to offer a final thank you to my previous guests, Ms. Ann Reeves and Rosario Aguirre from the Monterey County Health Department Childhood Lead Poisoning Prevention Program. Thank you, ladies, for a very informative program today. I also want to thank our audience for spending this time with us today. Thank you, viewers, and we certainly hope to see you again next month. I'm Emily Sciolto from the Monterey County Health Department, and I've been your host for today's Your Health Television program. Thank you.